live. We are live. Go ahead.
Hi. So my name is MonaLisa. I graduated in 2014, 2 years ago, with a comm degree. Right now, I work at Children's Hospital in Pittsburgh. I'm the patient advocate, and I love my job. I really do. And every day, it's really me using my communication skills. And I thought it's a really fitting of my major after I left college. So today, Dr. Guthrie kindly made me leave my job today and come here to present to you this. So I realized that when we're in college, we might not necessarily been given the different options of what type of careers we can go into as a comm major. So we might talk about, okay, there's marketing, there's PR, maybe insurance or business, but I don't think we might have a really good sense of what type of jobs, like what job title can we aim for? And specifically for healthcare, I don't think there's even much promotion on that because people usually talk about, oh, you either do doctoring, nursing, physical therapy, physician assistant, when there are actually a lot of healthcare jobs that require communication skills, that are actually hiring folks with a communication degree. So today I want to come and give you a PowerPoint presentation and show you what type of jobs are there in the hospital that you might be interested in. And if you're not sure, I sent you the PowerPoint. You can always give it to folks. So I think this might be a good start on learning about the healthcare field and what possible things you can do after you graduate. Sounds good? So what I was saying, you don't need a medical degree to work at a hospital. We have non-medical positions in the hospital that have nothing to do with patients. Even so, it has nothing to do with treating patients, touching patients. You don't need to get an MD or a nursing or medical degree or even a CNA. You don't even need any medical training for it. And today I want to start from the bottom to the top. I'm going to start at the most basic lower level position that you can get that's not medical, and then I'm going to go to the top, which is our president of the hospital, right? So this is the basic level patient registration. So when a patient walks into the desk, someone at the desk greets you, right, and say, hey, can I get your information, your name, your address? I need your insurance card. I need you to fill out a few, paperwork before you can go in and see the doctor. So patient registration obviously is very important, really important step when receiving patients, right? So you work at the desk, you welcome people, you get their data, you type it into the computer, you answer phone calls, you schedule patients for the next week, for the next year, all of that. And obviously this is not a medical position, of course. So typically when we're talking about education, we just need a high school diploma or GED, all right? And then average salary, this is per year, is around $25,000 a year, all right? So if you decide to go into this position and work full time, this is how much you get for a year, all right? And this is at the basic level at a hospital, all right? Now we're going up a little bit now. So unit secretary are secretaries, but at a hospital. So we need these people to account for medical data, to file paperwork. So you have to realize that doctors and nurses are working 80 hours a week of treating patients, discovering cancer cures and stuff, and they need someone to check their bank account, their phone emails, their voice messages. They need a secretary to keep records and all of that. So this is where a secretary is very, very important. When you go to the hospital, you have different units, right? You have one unit for cancer, one unit for heart disease, and you have one unit for asthma or something. And each unit do have one, maybe two secretaries, right? Basic level, also high school diploma, but they do require you to have some training in data collection data reporting and all of that. So it's a little bit higher level than just, at the patient registration desk, right? Now, an advanced title, have you heard of administrative assistant? Probably have, right? So that's a very advanced secretary. So if you stay in this position after 10, 20 years, you get promoted eventually to become the secretary of a very important person in the hospital. A manager, a director, the vice president, or even the president himself. And these secretaries make a lot of money, right? Because they're handling sensitive information about the president, right? And when you get to that position, obviously you earn a lot of money, right? So if you start at the basic level, you earn $27,000 a year. And then over years, like 5 to 10 years of experience, you get to move up and eventually become an admin assistant, or we just call them admins, right? So this is the next level here. So this is probably the most popular, most sought out position in the hospital, in any industry. They're always looking for call center representatives. They're always looking for someone to take phone calls, to answer patient questions, to file complaints, to schedule appointments, all of that, right? So if you're looking for a position where you can quickly use your communication skills and make, a fairly decent amount of money, way beyond, the basic level, this is it. This is it. They want more than just high school diploma. They want you to have customer service experience. So if you have worked like a Rite Aid, CVS, or at a restaurant, hopefully you have in some sort. I worked at Six Flags when I was in college. So when you graduate, right, and let's say you're looking to go into call center, they're looking for these experiences. They're looking if you know how to talk to a customer, you can talk to people. A lot of times, even writing, if you know how to write emails and all of that, or even write proposals and stuff. So so this is technically very much higher level, and you can see the salary is much higher level, right? Now, after a few years, when you get more experience, you become a specialist. So a specialist is when you focus on just one thing. When you're billing patients for insurance, or you're handling complaints from patients, or you're handling enrollment issues. Like you want to enroll people into Medicare, Medicaid, different programs in the hospital. So when you become a specialist, you earn a little more. The average is $35 a year. So that's it. If you're looking for something, right out of college, they love hiring college students. They really, because they expect college students to have customer service experience, and that's what they're looking for. So this is the next one that I do. I love doing this. This does take some skills, because the point of the patient advocate is you're solving complaints every day in the hospital. For instance, yesterday I visited 35 patients. Good thing 32 of them didn't have a problem, but then 3 of them had some issue with the cafeteria, some issue with the nursing staff, some issue with something. And that's what I'm here to do. I'm here to figure out why they're upset during their hospital stay and what I can do to fix it. A lot of times it involves different people. You might need to contact a manager, to contact a social worker, to contact a nursing director. So it requires not just talking to people and taking their complaint, it also requires you to know how to talk to other people, refer their complaints. It requires you to solve the complaint, but what I can do to solve it, whether it's getting vouchers. A lot of times you get vouchers. Just please take the voucher, go and get something to eat, or take this coupon, like trying to do service recovery, right? Other times it's okay, I will bring the nursing manager in here in an hour so you can talk directly to that person, right? Other times it's, here's a survey, write down all your complaints, and this will go directly to our director in this department. So there are a lot of things that you need to do as a patient advocate to make people happy and to make sure that you're solving people's issues. Now, because it does take a lot of thinking, your salary is going to be much higher, and they do expect you to have a bachelor's degree, all right? Whether it's marketing, PR, counseling, psychology, social work, and whatnot, they do expect people to know how to solve problems and be sensitive to people's issues in this position, all right? And the next one is program coordinator. So, obviously, hospitals have events. We have fundraisers, we have events, we have health fairs, right? We have these community events in order to teach people how to be healthy, like the helmet campaign. Children's Hospitals with Nicole to work at the helmet campaign right now. Please, you're riding a bike, kids, wear a helmet, right? So that's a campaign. Or another one is maybe raising money for leukemia, right? You have different booths at different malls to raise money for that. A program coordinator, community outreach specialist, event specialist, you're basically planning these events. You're getting all the necessary resources, so let's make this event happen, right? Whether it's at a hospital, whether it's at a school, a church, a health fair, a PNC bank or whatnot. And you're making sure that you're making these events happen, and that through these events, people will live happier and safer and healthier lives, right? So obviously they need a bachelor's degree. A lot of times they hire people with an education degree just because you're educating people about health. But many times they do, they don't really matter what bachelor's you have as long as you have experience coordinating events. So if you've done any job or internship where you have something to do with planning events or visiting events, coordinating things, they will consider you for the job. And the average pay is a little bit higher, going higher and higher now, at $39,000 a year, right? Now the next one, this is probably the most popular route for comm majors, corporate marketing and public relations. So each hospital, they need people to promote the hospital, right? If you drive around, you see UPMC ads, billboards, you turn on the TV, you see advertising TV commercials, right? You need people to do these things for the hospital. And why we do that? Because hospital is essentially a business. We're here to save lives, but at the same time, we're here to make money along the way. So we're trying to attract patients to come to our hospital so that we treat them, but we also get the money, right? So we have marketing, communication, public relations, social media specialists. And the nice thing is we work at headquarters. For instance, I interned at UPMC headquarters downtown. You see that tall building with UPMC on it? I interned on the 57th floor 2 years ago. And that's where we would work at, right? At the headquarters, right? Where the managers and directors would work at, right? And obviously they expect a bachelor's degree in English, communication, marketing, all of that. And honestly, your pay is a little higher. See that, $45 a year on average, right? And this is why this is a very popular route for a lot of our comm majors, right? Managers tend to get an MBA. So eventually, when you become a manager, they do expect you to get a master's degree. And usually they get an MBA because it's all about business, right? And lastly, we have healthcare administrator. These are the managers, directors, and executives of the hospital. These are the people that run the hospital. So you have doctors and nurses that treat patients, but we have these people that represent the hospital. This is what the hospital is about. We need these people to make sure that finances are checked, we have the money, we have budgeting, we're hiring the best people, and all of that, right? So if you look, I found this picture, that's our chancellor right now, right? He's our chancellor. And then that's the president of CMU in the middle. And then to the left, that's the president of UPMC right now, Jeff Normoff. So these are the people that run the hospital, right? So obviously, you're gonna get paid a lot more money because of that, right? But because of that, they expect you at a higher degree with education. So with that said, they expect you to get your MBA, your MHA, And sometimes they do expect you to do a fellowship after you get your master's degree. So I'm actually coming back to Pitt in August to get my MHA because I'm going into this position. So if you have any questions after this presentation about, I see your hand, about how to go into this field, what's the program about, and all of that. After the PowerPoint, I can explain more about that. Okay.
So just to clarify, they want you to have 2 masters, 2
No,
business.
no, it's one. These are different options.
Okay.
So typically, they either get an MBA or an MHA or some other type of master's. We have nursing, we have doctors that go into being a president that has their MD degrees and have their PhD degrees, and that's totally fine. But my point is, when you're at the higher level of status, where you're running an organization, you do expect to have a higher degree. So, makes sense? All right. Right then. So, becoming a manager. So I have this slide here because it's something to think about. When you graduate and you go into the working force, eventually you will be asked to move into supervisor or manager, right? That's inevitable, right? For a few reasons. Number one, after a few years working at the position, you get more experience, and with more experience comes responsibility, and you're asked to go into management. Number two, managers make more money than the subordinates. Does that make sense? And when you get married, when you have children, you do want to think about, how am I gonna pay for this house, pay for this car, take care of my kids. So, so that's why people go into management, because, they earn more money, they get more respect, and they get more opportunities, like better hours. You don't have to work Saturday and Sunday, better hours Monday to Friday. Better benefits, of course. A lot of these people even get to travel to different places, and their traveling is being paid off by the organization. So that's why a lot of people go into management. But that's why I want you to, to earlier on think about this, because it's not just about, oh, I'm going to be a marketing specialist when I graduate. Because when they hire you, you have to start training yourself to be a manager. Because all the years that you work at the company, you're there to build skills, build up your communication skills, your networking skills, your job skills, so that 5-10 years down the line, when they'll be more confident in asking you to be a manager. Does that make sense? So that's why, when you graduate from college, you start at the entry-level position, and eventually you move up to mid-career and senior positions like manager of marketing or the president of the hospital, right? So hi, how are you? All right. So now this is probably the biggest question you have. How do I go into the hospital field, right? Yeah, I got all this information on different careers, right? I have this comm degree. Okay, I'll probably apply to go into call center. Or I'll probably apply to be a communication specialist. But where do I start? You might be going, where do I start? So for those of you that are juniors, you still have some time. I'll start with this one. Get an internship at the hospital in your junior or senior year. That's really big because these companies, they prefer to hire their interns, right? And that's why they have internships. These hospitals, they create internships to train the next leaders. They hire interns to train them into the field, in the job, and then with the hopes that when they graduate, they'll hire them. So my first suggestion is getting an internship. If you're a junior, you still have time, you have your summer coming up, and you have 2 more semesters in senior year to get an internship, right? If you're a senior, it's still not too late. We do have, there are a lot of hospitals that do accept college grads as interns. You can intern during the summer after you graduate with the hopes that they hire you after the summer, right? For instance, UPMC, they do hire college grads as an intern. So, that makes sense? All right. Another one is volunteer. So even though you don't intern, volunteering is also a great way to step in. Because hospitals, like I said, hospitals want to hire people that they have, right? Hire people that they know. So as a volunteer, you already know the hospital, you know the people there, and when they post, positions, they want to post, positions to people that they know already, and volunteers are one of them, right? So for instance, I have like 3 jobs. My part-time job is at the American Red Cross. I started out as a volunteer intern actually, my second internship with the Red Cross. After my internship with them, I continued to volunteer with them, after school and whatnot. And then when I graduated, they told me, hey, we're hiring a health and safety inspector part-time. Would you like to apply for it? And that's when I applied, I did the training, and now 2 years later, I'm still a health and safety instructor for the Red Cross on the weekends. So volunteering is another route, to get accustomed to the hospital environment, to know people, to network with people, all of that. Start at the part-time position. So a lot of people, this is another smart way, they start working at the hospital when they're in college. So like, a lot of people, you might work at CVS, Rite Aid, at Five Guys while you're in college. So similar, some people, they decide to work part-time in the hospital while they're in college. For instance, at, let's go back. So patient registration, since they only require a high school diploma, a lot of college students, they work at patient registration while they're in college as part-time, like after school, on the weekends and stuff. And then when they graduate from college, right, either they get a full-time position as a supervisor because they worked all 4 years at the clinic. So they have 4 years of experience. So when they graduate with a degree, they can go straight into management. Or, right, they get first dibs on other positions in the hospital because they're already an employee at the hospital. So the way it works is most of these hospitals, they post positions internally first. So current staff get to see the posting first. And then if nobody takes the position, then they post it for the public, which is why, like if you're a current staff member, you're at like a better edge at getting, higher jobs at the hospital because you see them first, right? So, next slide. And lastly, the last one, if you think you're qualified, right? If you think that you have all the internships and experience that you need by the time you graduate, then go ahead, go and apply for the positions. You never know if they're gonna, hire you, right? And if you have like 3 internships and a research fellowship and like 5 different volunteer positions like I did when I graduated, I got a job pretty smoothly, right? So please go ahead and apply. You don't know what they're gonna say. All you can do is apply, right? You're not gonna have a chance unless you apply for these positions, right? And don't be embarrassed. Apply to as many as you can. You don't want to just apply to one position and think you're gonna get it, right? If you most of the time, hospitals have different positions in the same department. Like they might have different patient advocates positions. They might be hiring different marketing specialists. They might be hiring multiple call center representatives. So apply to all of these positions. Apply to all of them, because then you have a better chance of being hired. And HR will see that you're actively seeking, and they're more likely to contact you because they see that you're serious about this, right? So, right. So that's about it, really. The last point is do what you want to do. I'm not here to tell you what to do. I'm not here to tell you need to choose this career or that career. And I'm not here to tell you need to pick a career just because of money, right? Money is important, but at the same time, you want to pick the job that you want to do, right? So if you want to work in call center, please go and do that. If you're great, if you're talented in picking up phones and answering phone calls, do that, right? Because eventually you'll be promoted to specialist, you'll be promoted to manager. But when you get to call center manager, you make like 45,000 to 50,000 a year, and that's pretty good, right? Pretty good to pay off your loans and buy a car and all of that, right? But if you're like me, you know, I started a patient advocate, which is a bit lower in salary, but then I'm going into hospital administration, which is going to jump me into like the $90,000 range. Go for it too, right? I want you to, you know, think about this, think about what you want, and go for it. Don't think about money and go for what you want to do, right? Now, my last point too is that you don't have to be a doctor to earn a lot of money. And the reason I say that is you are at a position where you're not going to be stuck to a doctor's or nurse's schedule, which is amazing. For instance, when you work in corporate, when you work in the communication field, when you work in the administration field, you have an amazing schedule. You work from Monday to Friday, 7 to 4, 8 to 6. You don't have to work weekends, right? You might have a phone to bring you home with, but my point is you have a great schedule, you don't work weekends, and you're not on call. And you get to make a lot of money with that. That's what I love about this field. Versus if you go into being a doctor, you have to work 80 hours a week. I don't know how, do you know how long is 80 hours a week? You don't have any social life, okay? You're just working, you're sleeping at work. As a matter of fact, we have rooms at the hospital for doctors to sleep because they can't go home. When they're done with their shift, they go straight to the room on the 4th floor and sleep, and when they wake up 5 hours later, they go straight to work. They don't get to go home. So think about lifestyle too. Like, what type of lifestyle do you want? You want to think about, you know, does this job allow me to have a social life? You know, does this job require me to work weekends? Do you want, or do you not care about weekends? Like maybe you're single, you don't have a boyfriend, you don't have a fiance, and you can just, you know, work all the time. But for me, you know, I need my weekends. You know, like I want to get out of work by 6 and go home, spend time with my family, and do other things, you know, right? So think about that too. Like think about your lifestyle. Like what schedule do you want? Monday to Friday, Sunday to Saturday, 7 to 8, 11 to 7. You know, do you want to have time with your family, or do you just want to work all the time? Just think about these things, and then once you figure out what you prioritize, then you can really better figure out what's the best career for you. All right? There's no yes or no answer. If you like to work, work. If you don't like to work, you just want to work part-time, that's totally fine. But you want to keep in consideration, you know, what do you want to do? What type of schedule do you want, right? And is this salary enough for me? And most of the time, it is enough salary. So, well, this is the end of my presentation. It's around 20-25 minutes. That's cool. But do you have any questions about hospital? I know you walked in late. If you have any questions, please ask me. But do you have any questions about going to hospital careers and all of that? It was pretty self-explanatory. Do you have any questions about getting internships? No. No, are you interested in getting internships in Pittsburgh? Like who's in Pittsburgh? Are you in Pittsburgh? You're in Pittsburgh? Because I do have be back. I do have a list right here internships. And I emailed it to you. Okay. But I have a list of internships in Pittsburgh that's in healthcare. But they're in healthcare, but they're hiring comm majors. Does that make sense? So anybody want that too? Okay. Do you guys want to go? You take one. Okay. You guys. So basically, now the first two internships I have done. I've interned I was a summer associate at UPMC. That's like the best internship in healthcare you can get in Pittsburgh. Like, if you can apply, please do so. Please. The internship program is amazing. They're campus recruiters all the time at Pitt, all the time at CMU. They're there to answer questions. They're there to hire you. They want to hire students into their program. And their hiring rate after college is like 60 to 70%. So basically, if you get into this internship, they want to hire you. There's 60 to 70% of them hiring you after you graduate from college. So the next two is American Red Cross. I interned there. That was my second internship back in 2012. It's non-paid. However, I got a lot of amazing experience from it. Even though, so just because it's non-paid doesn't mean you should push it away. All right, but make sure you're still having some type of income from somewhere else. All right, but the Red Cross is also a great place. They're looking for comm degrees, comm majors and stuff. They're in the Strip District. You can take the bus 54 there. UPMC is downtown. You can take any bus that goes downtown to their office. And the Red Cross also has a national headquarters internship that is paid. They're in Washington, D.C. If you're interested, you can go and apply, right? And if you're looking for summer internships for the Red Cross, I know the internship coordinator at the Red Cross in Pittsburgh. If you're interested, I can give you my name and my email address and stuff if you want to apply for the summer or next year. Okay, I have that information if you want. All right. And then the others are other healthcare companies in Pittsburgh. They're Highmark. That's actually UPMC's firebrand company in Pittsburgh. They offer a lot of internships. Jewish Healthcare Foundation, Consumer Health Coalition. We have quite a few healthcare companies in Pittsburgh that's hiring comm majors because they need us to write articles, write blogs, write advertisements. They need us to plan events. They need us to talk to patients, talk to families, promote things for them. And these are skills that we learn as a comm major, right? So I want you to know that your degree is very, very valuable when you leave here. It's valuable in any field, and I work in healthcare, and I can tell you it's very valuable when you work in healthcare. So, all right. Any questions?
Oh, just for the summer associate thing, how, like, I'm kind of looked into it, and it seems like it could be a little long, but, like, from your personal experience, like, how did you feel it was? Like, was it, like, a full-time job kind of thing? Or was it, like,
in the summer it was.
Yeah.
So, for that program, you're late. They're
Oh, yeah.
yeah, because their application process starts in, like, November, and they end in, like, January. So you're kind of late. But like I said, they do hire college grads. Like the summer after you graduate, they still consider you. So don't fret. Apply next year, okay? But they hire about 70 to 80 interns. Not in comm, in overall. They hire interns from the business school, from comm department. They hire people from IT, from the IT school. They hire nursing students, and all of these students count up to about, when I was there, it was 69, and that was 3 years ago. So it's probably more than 69 now because it's always expanding. But they do an orientation in May. You start the last week of May, and you work full time, Monday to Friday, until the middle of August. So it's rigorous because they expect you to do a presentation at the end of your internships on what did you do. They assigned you a mentor, so I had a mentor while during the summer. Check on me and say, hey, what are the career goals? What can I help? How can I help you complete your job during the summer? Can I answer any questions about this department, about doing this job? I was offered to stay longer, actually. When I was done, I was offered to stay longer for an extra few months because they love interns. They hire people through internships. So yeah, that was my experience. It's very great experience. So.
I've heard that UPMC's internship program is such a bear to get into because they sort of they assume that if you do a good job at the internship, you'll end up with a job.
Mm-hmm.
And so they make it really hardcore to get into, but once you're in,
You're pretty good. Like for me, I stayed, but then I decided to do research, and I got into another position after I graduated. So that was me. I decided to not stay with them, but still, my internship was very valuable. Like for me, when I applied for jobs when I graduated, it was so easy because people knew I had experience. Whereas there was 13 people. I'm really specific. There's 13 interns in my marketing department when I interned. Out of 13 of them, I believe 8 of them were asked to stay. Okay, out of 13, 8. Yeah, so 8 of them asked to stay. I was one of them, and then 6 of them got hired when they graduated from college. So that gives you a perspective on that. So. I'm pretty sure all of us 13 were asked to stay. It's just that some of my friends, they decided to do something else. I have a friend, she decided to go into fashion design. I don't know how that happened. So after that internship, she said, no, I don't want to stay. So she went back to her hometown and she's doing fashion design right now. So, you might change your mind. But like I said, their internship program is very rigorous. They want to hire their interns. So. Mm-hmm. And wherever you're from, like if you're from Philly, from New York, from Boston, and all of that, look into your local hospital. There are like, look into the biggest hospitals in the area. For instance, I'm from Massachusetts, so Mass General is the biggest hospital in my area. Everybody wants to intern in Mass General because once they get in, they'll get hired, something like that. Or in New York, you have different hospitals in New York, different hospitals in Philly. CHOP, the Children's Hospital of Philadelphia, that's another big one. A lot of people want to intern there too. So look into your local hospital because that's how they hire. Every hospital hires like that through their interns. And if not, go into volunteering, start a part-time position, or directly apply to the position.
thank you very much for coming. And MonaLisa was president of Con Club. She's going to be president of the Red Cross at some point.
One day,